Welcome, everybody. I am your host this evening, Cody, from your Future Students team here at University of the Sunshine Coast. And today we're talking about health promotion and public health, positively influence the health and well-being of entire populations. Tonight, we're going to cover a range of different topics, including introducing our special panel members, Dr. Jane Taylor and Dr. Bridie Keane, who are both academics here at University of the Sunshine Coast, based on our Sunshine Coast campus, but also teach online. But we're also going to cover a range of different study areas as well as a masterclass topic to get you a little bit more depth knowledge around public health and health promotion and what it can offer in our local communities. A bit later on, we're going to be having an open panel discussion where we're going to answer all your questions. Now, on the topic of questions, you'll notice at the top or bottom of your screen, depending on what device you are on, there is a Q&A button available to you. This is where you can type in any question you see fit. It could be around programs, it could be around the topic area we're looking into. It could be about your study pathway and what you're planning to do with your current skill set or where you're trying to get to. And either Bridie, Jane, or myself will be able to answer them throughout the evening. So if you do see that Q&A button and you do already have a dying question, feel free to start chucking questions in now. We'll be able to answer them straight away, or alternatively, we'll save them for the panel discussion a little bit later on. We acknowledge the traditional custodians of the land on which we work and live and recognize their continuing connection to land, water, and community. We pay our respects to elders past, present, and emerging. So a little bit about UniSC. Well, we're actually a multi-campus university. We have multiple campuses across the east coast of Queensland, starting all the way up in Fraser Coast, or what you may know as Harvey Bay, then to Gympie, Sunshine Coast, Caboolture, and Moreton Bay. There's a range of study opportunities available to you. And of course, we also teach online. And if you are planning to be an online student with us, no worries at all. You can also utilize our facilities as you see fit. Pick up a student card at the start of your sessional intake, and you can use this to enter all our facilities 24/7 to feel that you really are an on-campus student, but also separating that home life, uni life, and obviously all the balances you have to manage in between. Tonight, we are joined by Dr. Bridie Keane, our Senior Lecturer of Public Health, Postgraduate Public Health and Health Promotion Programs, as well as our Discipline Lead, Dr. Jane Taylor, who'll be covering our Masterclass topic a little bit later on. We have a range of amazing support services here at UniSC in and outside of your studies. We have academic and study support. We also have an amazing careers and wellbeing team, health and well-being, financial support and scholarships, including postgrad scholarships if we are looking at studying with us, student groups and partnership opportunities, counseling, as well as disability and equity support as well. If you identify as needing any of these services, they are all completely fee-free. You can use them as a new student or a current student. Some of these services are actually available before you even apply. All you have to do is go to usc.edu.au/support and kind of explore the options available to you, or get in contact with our Student Central team, which will provide their number at the end, and see how our support services can support you on your journey. I think this is a really good opportunity to introduce Dr. Bridie Keane onto the screen. Bridie, I'd love to know a little bit about you and your career, and maybe your a past history of what brought you to, I guess, work and teach in public health and health promotion. Over to you, Bridie. Thank you.
Thank you so much, Cody, and it's lovely to be here on a Thursday night. I have the incredible privilege of being the program lead of our postgraduate programs in public health and health promotion. I guess my journey in public health and health promotion really stemmed from my own lived experience. So I grew up, I have a disability. I've got a physical disability. So I use prosthetic legs. Had my feet amputated as a result of meningococcal when I was a baby. And I really wanted to be involved in sport and physical activity growing up in Australia. And it really led to a passion where I pursued a career in sport. I played wheelchair basketball, but at the same time, I really wanted to explore how we can reduce the barriers and enable facilitators for people with a disability to be involved in sport and physical activity in Australia. And it really led me to public health, where you'll find out through this masterclass and tonight that we in public health are about understanding the role of the environment and how the role of the environment can impact the health and well-being of entire populations and groups and communities. And then in health promotion, we can go about looking at strategies and ways that we can create health and wellbeing initiatives by addressing the different factors at play impacting people's lives. And so I look at that in a physical activity sense in terms of how we can use public health frameworks and health promotion strategies to enable more people with a physical disability to be more active and involved in sport. So that's a little bit about my background in my research. And then in terms of my program lead role, I get to work with all our postgraduate students who are all online. And so over the past years that I've been in this program lead role, I've been able to connect with people, students, mainly most of our students are here in Australia, but all around Australia, and we connect online and we deliver our courses completely asynchronously, meaning that students have no need to come to any classes, any scheduled classes in the online setting. However, we have regular face-to-face drop-in sessions where I've been able to connect with students and support them on their learning journey. I'm now going to talk about our different programs that we have in our postgraduate suite of programs. So we have 2 graduate certificates, a graduate diploma, and they are all nested within our Master of Health Promotion. So I'm going to break down a little bit about the different programs and how they all articulate up to the Master of Health Promotion, which is our fully accredited program with the International Union for Health Promotion, um, Health Promotion Education. So our graduate certificate in health promotion is 4 courses, and it focuses on our technical health promotion courses, sorry, and you'll learn more about what health promotion is in the masterclass shortly. And so our graduate certificate in health promotion in the 4 courses, they are in session. And so you can complete this graduate certificate in 16 weeks if you do it full time. However, I will say many of our students do balance their studies with other commitments. And so many of our students are also enrolled part-time in the graduate certificate in health promotion. Our other graduate certificate is in public health. And our graduate certificate in public health, if I think that's on our next slide, Cody, is our foundation public health courses. So again, in our masterclass tonight, we're going to talk about how health promotion is a sub-discipline of public health more broadly. And so our graduate certificate in public health enables students who are looking to embed public health knowledges into existing careers or start a public health career to focus on public health specific courses. And again, this is completely online. There's 4 courses to complete. In full-time mode, it can be completed in 16 weeks, but many of our students take it 1 course at a time and complete it over a year. Our next program I'm going to talk about is our graduate diploma in health promotion. A graduate diploma is 8 courses, and so full-time, that's 1 year of study. And our graduate diploma in health promotion is particularly useful for those students who are looking to advance a career in practice, in health promotion practice. So in those 8 courses, you complete the technical courses that enable you to embed health promotion knowledge in a role where you're working in industry. And it does also articulate to our Master of Health Promotion. And what I mean by articulate is that when you do your 8 courses in the graduate certificate in health promotion, if you are then wanting to go on and complete the full Master of Health Promotion, you then go on to do further study. So I work with a lot of students when they're starting their study journey in health promotion, and we actually map so that they start off with a graduate certificate and then they keep building the courses up to go through to the full masters. And what that means is if at any point in time they feel that they have the qualifications suitable for their career, they can then graduate with that qualification at the graduate certificate or then graduate diploma level, or they can keep studying and continue to go on to do the full 2 years of the Master of Health Promotion. I'll jump now to our Master of Health promotion slide, where I'll spend a little bit more time talking about this program because, as I said, all of our other programs are what we call nested into this program. So every course you're doing in the graduate certificate or graduate diploma is actually contributing to this Master of Health Promotion pathway. And our Master of Health Promotion has some other notable aspects to it, which is on the screen there. You might see there's also the option for a reduced volume of learning. So our Master of Health Promotion is 2 years in length, so that's 16 courses over 2 years. But we do have a number of bachelor degrees that are recognised in a similar discipline. So if you have a health a bachelor degree in health, you might be qualified to access a reduced volume of learning, which can reduce the Masters of Health Promotion up to a whole semester. So then it becomes a degree that you can complete in 1.5 years full time. Our Master of Health Promotion has what we call these two pathways. So we have the practice pathway, and that's about providing coursework and program learning outcomes that are going to help you to achieve the competencies that lead to an international accreditation as a health promotion practitioner. And you'll hear more about that in the masterclass. The other pathway we have in the Master of Health Promotion is our research pathway. So through the Master of Health Promotion, you do foundation and advanced research courses, including a research capstone course that prepare you for if you want a research career in health promotion. And whilst it's not an automatic entry, we've had many students who have completed their Master of Health Promotion here at UniSC, and then they've gone on to commence a PhD in health promotion. And so they have those two varied career pathways where they might go on to have a career in practice, in health promotion practice, or a career in health promotion research, or many of us love to combine both and have contributions both in health promotion research and health promotion practice. And on that note, I'm about to introduce you to someone who has a lot of experience in both health promotion practice and health promotion research. So if you are thinking about asking any questions before I introduce you to Jane, we do have this set up where the graduate certificates are 6 months each, the graduate diploma is 1 year, and the Master of Health Promotion is 2 years. And I spend, as program lead, I get to meet a lot of prospective students and a lot of students and chat to them about their career pathways. And so I love that part of my job. And so tomorrow you will actually receive an email with my details. And I'm very keen to chat to you all individually about your different career pathways in health promotion or public health, and we can talk about how the different programs might suit. But it is my great pleasure to introduce our discipline lead, who is Associate Professor Jane Taylor. Jane is the most experienced health promotion practitioner and researcher that I have had the privilege of knowing. And so I'm now going to hand you over to Jane, who is going to take you through our masterclass tonight. Thank you.
Well, thank you, Bridie, and thank you, Cody, and thank you, everyone, for coming along tonight. It's always humbling, but always exciting to talk to anyone that's interested in working in public health, health promotion, and coming back to study. So a little bit maybe about me, just for a little bit of context to start with. I think I'm very privileged to work here at the Sunshine Coast. I've been here for actually 20 years, involved in the programs here from their conception. Then I've left and I've come back. And but I think for me, I actually didn't start in this space. I was a teacher, and I grew up in Tasmania, and a very good public health strategy. I wouldn't be standing here if I wasn't at the time when I went to university, a recipient of free education from, at the time, the Whitlam government. So many people that would have normally had the opportunity to go to university, including me. I grew up in a dairy farm, big family, and there's no way I would have got to this place if education hadn't have been free at that time. So a very good example of the public health policy that enables or facilitates access to education and equity for those that might normally have that opportunity for that. Well, it's a right, actually, education. So from there, I was a teacher, and I taught in the health space. And so I taught for the first sort of 10 years or so of my career. But I was in the Territory, and so I got really interested in Aboriginal, Torres Strait Islander Indigenous health, and in those communities I was working in. And I've always interested in women's health. So I just, like you probably maybe, just thought, oh, I would like to do something else, a bit more study. And so I actually enrolled in the first health promotion degree through Curtin University at the time, the very first one in the country. And I did it by snail mail. So all the packages that get sent, and handwrite your assignments and send them all back. So very, very different space now. But from there, that enabled me then to move into practice. So I first worked in women's health and community development. And I also worked on a lot of programs around Aboriginal and Torres Strait Islander issues, particularly setup of services in Queensland. And also I was involved in the establishment of public health infrastructure and services across Western Queensland. And then I sort of ended up back coming, and I didn't come to academia. It wasn't ever my plan, not ever my plan. I never thought that that's where I'd end up, but I think my teaching background really, I've never sort of let go of that. So I always enjoyed teaching. So I combined my two passions, and so here I am. So that's my story. And I've actually left academia a couple of times and gone back to practice, because I didn't start academia, I think I was 40. So it sort of was a second career for me. And I think that's the case for a lot of people that come into public health and health promotion. And we have a lot of people from nursing, a lot of teachers, they come in and go, yeah, I want to just work on sort of have a different focus, and I want to work with populations and communities rather than working with individuals, etc. So we have a lot of mature age students come into postgraduate space, but also health promotion in particular. So I might then just sort of just talk a little bit about public health and where health promotion in particular fits, because that's probably that's where our postgraduate programs, our strengths have been here, and we've always specialised in health promotion, had an accredited program, because not a lot of universities actually have a master in public health, master in health promotion specific accredited programs. A lot of universities have a broader sort of generic public health programs or master's programs. Essentially, though, public health is sort of the umbrella or the broader discipline that health promotion fits into. And public health is really concerned about the health and wellbeing and protecting and promoting the health and wellbeing of populations and communities. So while we're more interested in big groups of people than individuals, but individuals are important, obviously. But those populations or communities could be global or regional, state, Sunshine Coast, your regional areas, your local government areas, your street. So we're groups of people and populations. The three sort of fields in public health, or main sciences, I suppose, is epidemiology. So we work a lot with epidemiologists, and in the program you get introduced and do a course as well in epidemiology, but that's about data, and people that love data but often gravitate to this space, but really interested in looking at how health and wellbeing and the patterns of health and wellbeing, how they're distributed across or between and within populations. So understanding who's got what where, really, I suppose. Environmental health is another really important area and field, discrete field in public health, and increasingly becoming important with the climate change agenda as well, and particularly given the exacerbation of health inequities that are associated with climate change also. And I'm just thinking now just in the Pacific region in terms of our local region. But environmental health practitioners and researchers are interested in that relationship between health of people and their physical environment. So environmental health people, they're the people that are responsible for responding to disasters and the health aspects of disaster response, make the food safety, the quality of water and air, waste management. So if you're interested in that relationship, then environmental health is it's fascinating. It's great. We're actually looking at, and we will be introducing a graduate diploma in environmental health from 2028 as well. So just to complement our suite of postgraduate public health programs. What we're here more to talk about today is the health promotion. And so health promotion are the people in the public health system that are involved in creating the environments, because we all live in a whole range, different in an environment, social environment, political environment, physical environment, natural environment. So we're interested in how we create the conditions in those environments that are good for people's health and well-being, that support people to be healthy and well and live their sort of optimum lives. There's a bit of a list there on the side of some of the sort of broader, global, right down to local public health priorities and things that we're interested in at the moment. We don't all work in all spaces, but obviously, pandemic preparedness off the back of COVID, and we've all experienced that. So that's high on the agenda of public health. I'll just make a point too here. Sometimes public health is misinterpreted as the public health system, so the hospital and health services, rather than the health and well-being of the population. So sometimes public health is also referred to as population health. So public health is not the public health system. There's also, non-communicable diseases. Mental health is a massive increasing priority. Health equity, and I think I'm really passionate about health equity, and I don't think we can think about any of these issues and these public health priorities without thinking about health equity and thinking about those that are impacted most by any of these issues, many of which are interconnected and interrelated. And it's usually those with least are most impacted, and our inequities between the rich and the poor, and who the haves and those that don't have is increasing. So really important. So you might even work in or be familiar with some of those priorities, but that's sort of the broader scope of priorities that we're interested in. So thank you, Cody. So in terms of health promotion, what we actually do, and people ask me this, my parents, my mum still, she says she used to like it when I was a teacher, and because she could say Jane's a teacher. When I was a health promotion practitioner, it was a little bit harder for her to explain what I did. So, but essentially what we do, we're the people that take the information about the health and wellbeing issues, and where there's issues and where there's work that needs to be done. And we're the ones that advocate for or facilitate and design and implement and evaluate policies and programs that create health and wellbeing. So it's really about a process. So we have health promotion practitioners, and I'll talk about this in a minute, but we have those sort of strategic and management and leadership and program planning skills and capabilities to make things happen and get things off the ground. Just thinking about policy, and we know that, you know, healthy public policy is a really important area of work for health promotion and in public health. And, you know, it requires a lot of advocacy to get policies in place that create environments that support people. And I'm just thinking off the back, you know, there's the gun law stuff, and that's back on the agenda nationally. Australia's done quite well in that historically. But the policy around plain packaging for laws for tobacco products, for example, seatbelt and random breath testing and policy, those sorts of policy agendas. A lot of the work around gender-based violence has been a lot of work in the policy space there too. So health promotion people are very often involved in the front end of that work to advocate for changes to policy that then result in often issues becoming national priorities, and from there we end up with strategies and national plans and local plans around priority topics that for which a resource and for which resources flow. So it's a process, and it's a positive process. We're also really interested in health promotion of thinking about health holistically, and so we really focus on the physical, mental, social, and whilst the World Health Organization doesn't have spiritual well-being in their current definition, I think that's super important. So we're interested in, you know, holistic health and well-being, and thinking about health as a resource, not, you know, the objective of living. So in terms of a broader practice framework, the World Health Organization, you know, have got to set the agenda and the strategic agenda for health promotion, and they've got a framework that's got some age about it now, but it's sort of done the test of time. But it's called the Ottawa Charter for Health Promotion. It's in the middle of that slide. But what we do when we design policies and programs is that we implement and design strategies and combinations of strategies that are about developing the personal skills of people that, you know, for example, health education is a good example of that. We use social marketing, for example, to raise awareness about issues. And we've got, you know, a lot of the TV ads, and depending how old you are, you know, the original Slip, Stop, Slap stuff, the Drink Wise alcohol awareness campaigns, the violence prevention campaigns that are on at the moment. We had a lot of campaigns, social marketing going on through COVID. So health promotion people are in the back stalls informing and developing up those social marketing campaigns, which run alongside other strategies as well. So if we think about smoking, then, you know, you can't smoke in restaurants and bars and public areas anymore. So that's you know, that creates a much more a healthier environment for people. We have a lot of policy work and programs in relation to food, and particularly in schools and hospital settings. So we also have, in terms of creating supportive environments, we've got a lot of national programs. We've got national immunisation and breast screening and national bowel cancer screening programs. So the other big area here is also around strengthening community action. So the health and wellbeing of people is more likely to improve and sustain if people are involved in making their own decisions about their health and wellbeing. So there's a lot of examples, and particularly Aboriginal and Torres Strait Islander space, about how we really, you know, authentically engage Aboriginal community, for example, in running and organising the Aboriginal community-controlled health organisations are an example of that. And local governments also, they often have a lot of health promoting strategies that go on, for example, active transport, and Bridie's going to talk a little bit as an example of that in a little while. So I think I'll leave it at that, but it's so broad, but I think the message here is, you know, whatever role you end up working in, with a population group or on a topic, the idea is that, you know, we end up, programs are complex and policies and programs go together, and that's the skill set that we have to navigate that space and to design and roll out those policies and programs. In terms of jobs, oh, sorry, Cody, can I just go back? Jobs. So some people say, where will I get a job? There's health. Most health happens outside the health sector. I always often refer to that as the disease sector. So the health sector, if we think about all the determinants of health, we know that, you know, housing, local governments have a big role, sport and recreation, transport. There's a whole lot of determinants of health. And so there's a lot of opportunities and these sorts of programs and initiatives across local, state and Commonwealth government services. Most states in this country employ, particularly the state level services, health promotion officers, and the primary health networks also, which is part of the sort of the non-government sector. They also employ health promotion people to do a lot of their community assessment processes and some of their programs as well. So there's the government sector, there's the non-government sector. So there's a lot of, like Vic Health as a foundation, Diabetes Australia, the Heart Foundation, the Cancer Council, etc. They run health promotion programs as well. So they employ, and then there's the community-based organisations that local neighbourhood centres or advocacy groups. So I think the point is that often health promotion jobs are not named as such, but they have got different titles. Some are called health promotion officers, policy officers, community workers. It might be physical activity, a project worker. It might be a youth project worker. But I think behind those different titles is, you know, the skill set that you develop. Thanks, Cody. Move on now. Sorry. So the skill set that you develop is sort of represented here in this image. As Bridie said, our programs are accredited and internationally accredited with the International Union for Health Promotion and Education. And so that means that when you come out of your program, and Bridie referred to technical courses, that you come out with a whole lot of knowledge and skills that sits behind all of these components of this sort of framework here. And I'll talk a little bit more about that in a minute, but planning skills, community assessment skills, how to implement programs, how to evaluate them, communication and leadership, super, super important. And then there's this sort of foundation knowledge that underpins how we go about all that to ensure what we do is ethical and evidence-based. The World Health Organization sets the sort of broader vision and strategy around health promotion. And then locally in Australia, we've got the Australian Health Promotion Association. So and as students are actually able to join and get involved in the Australian Health Promotion Association as students. And that's a really good way, if you do get into the field, to start to network and make some connections. Thanks, Cody. So just, I think my work in this space, and I'm passionate, I was a practitioner. And so when you work in practice, you have to have some tools in your kit. And we refer to tools in our kit as models and frameworks to guide our practice. So that's where my research has ended up as well. And I've been really focused on, you know, contributing to the sort of body of work around making sure that we've got good models to inform our practice. So, and along with a colleague, Lily O'Hara, we've developed the Red Lotus health promotion model. And so that sort of evolved over the years and sits behind quite a lot of our work and our teaching, and it's used in practice and outside as well, and represented by that lovely pink flower there as well. So that's where we might go next. So I've talked about policies, programs, we need practice frameworks and models. And then it's like, well, how do you do that work? And so essentially a health promotion practice cycle quickly involves understanding what the health and wellbeing needs are and assets of a community so that we can identify what their issues are. From there, we can go about planning what we're going to do to address those issues, implementing the programs that we design, and then evaluating those programs to see how they go, and make changes along the way. And hopefully, they're designed well and we're working on the right thing and we've done due diligence in terms of our practice, then we have changes in health outcomes that we're looking for. The critical values and principles in health promotion are sort of listed down the side there, and that's probably part of a lot of my research work as well, as articulating what is it that really needs to underpin all that we do in health promotion. And so that list is, I would call them the railway tracks. I think if we can think about what's important and we make sure that what we do is underpinned by these sort of values and principles, then we'll be in a good place, and we will make a contribution and make more supportive environments for people. Thanks, Cody. Sorry. So the first part of that process is to, once we know what communities' issues are, is to understand the health issues that we're working on. So we do a bit of a health issue analysis, and we need to understand all the individual level determinants that contribute to a particular issue. So if we want to know about youth mental health and in a particular community and what's contributing to that, well, then what are the characteristics of the youth that are impacting or contributing to the mental health situation? And thank you, Cody. And we also need to understand what's going on in our broader environments as well. So this whole process is probably, I think, the most important part of our practice, understanding our issue at a really deep level. And it's complex as well. So it's all very complex, and a lot of our work is underpinned by systems science as well. So that's always fun. That's just complex. So understanding issues in that way is our starting point. So we thought that's probably a nice segue to give you a little bit of an example that Bridie's going to now take you through for a minute.
Thank you so much, Jane. So the example that we're going to take you through in the masterclass tonight is active commuting. So Cody, I might jump to the next slide and we'll talk about what is active commuting. So active commuting is within the, subset of what we call active travel, which refers to using a mode of physical activity to move from one place to another. So it usually refers to walking or cycling. But when I was talking to a colleague in our team, Dr. Anthony Walsh, who is an expert in this space, he also said it can be something like canoeing, but usually we're referring to walking or cycling. So when we're referring to active commuting, the public health priority of active commuting refers to people using walking and cycling to get to work or school, so to their vocation. And the reason that it is a public health priority is because we see significant health benefits of people actively commuting. So we see both physical benefits of the increased physical activity and reduced sedentary behaviour, but we also see benefits to mental well-being. And there are also what we call co-benefits, where we as people, our interaction with the environment can impact the health and well-being of the environment, and the physical environment also impacts our health and well-being. So by having modes of commuting that increases walking and cycling, we're also seeing significant health benefits to our environment and the planetary health. So when we look at what Jane's described as, we want to understand with public health priorities such as active commuting, what it is and its impact. So we've talked about what the definition is, its impact on health and well-being, who and where are most affected. So in our next slide, we look at, well, what's going on in Australia at the moment in terms of active commuting. And we can see that over time, the use of private vehicles is really, really high, and our use of public transport, cycling and walking to commute to work or school is really low. So there's an opportunity from a health promotion perspective to look at what are the determinants or factors influencing active commuting, and how can we come up with some strategies that encourage the population to increase levels of active commuting. So on our next slide, we've actually looked at how, and we do this in different topics across our health promotion and public health programs, where we would look at the individual and environmental level determinants of active commuting. And I won't list all of them on the screen, but you see that we start to understand the different contributing factors to whether or not someone is likely able to actively commute. And so if we look at an example of the built environment, factors like the density of traffic, um, where high levels of traffic might encourage people to consider using a bike or walking to work, is a contributing factor to whether or not someone is going to actively commute. But we also look at different elements of the political environment, such as policies that subsidise car use, have actually decreased the likelihood that someone is going to actively commute and actually encourage higher use of vehicles. Interestingly, commercial determinants, these are the things that in our economic environment, or that commercialization of products might make it more difficult to achieve health and wellbeing behavior like actively commuting, or more difficult. So as petrol prices rise, it actually encourages more people to actively commute through walking and cycling. And what's really important when we understand the determinants is that these determinants interconnect with one another. And so rather than it being a focus on an individual level and putting the onus on an individual to say it's an individual's choice to actively commute or not, we actually start to look at determinants and how they are all interconnecting with one another to contribute to active commuting. And so this is really important in public health and health promotion because, as Jane has described in great detail, it's then our role within health promotion to think about strategies to increase this behaviour of active commuting. So on the next slide, we've looked at some different ways that we would use the health promotion planning process to consider how we can come up with strategies that influence positive rates of active commuting. So we've addressed what is the health and wellbeing priority, what changes are we trying to achieve? So in this case, we're wanting to see a greater level of active commuting, and then how will we know that we've achieved these changes? And so on the next slide, we look at some of the ways in which we return to the Ottawa Charter, which is foundation for health promotion strategies and considering health promotion strategies. And we think about strategies that address different levels or different action areas of the Ottawa Charter. And so here are some really simple strategies that we already see have aimed to increase active commuting. Things like bike skills and road safety workshops would increase people's personal skills and willingness to use a bike in order to safely get from their home to their work or school environment. We see protected bike lanes might be a political or policy that local government can implement to ensure that people are safe when they're actively commuting. Interestingly, one of the strategies that has been successful in active commuting is end of trip facilities. So we know that when workplaces or schools have great end of trip facilities where people can get ready for their vocation, that increases the likelihood that someone might actively commute to work or school. We also see some great examples of what we call bike buses. And I have a PhD student who's exploring cycling behaviours in general. And this concept of bike buses is a great initiative where you have volunteers who might safely provide a way to go along with school children so that people that they're commuting together in what's called a bike bus. And it takes away some of the determinants that reduce the likelihood that a child would be able to safely commute from one place to another. So it's a thinking about a different way to address active commuting. And then another another policy perspective is financial subsidies for public transport. And we've seen that in recent years here in Queensland, where we're located, where we've had a reduction in the cost of public transport, which then increases the likelihood that someone has a component of their commute where they're walking and therefore actively commuting. So this is a really quick example of how we can consider a public health priority and how health promotion can play a role in contributing to that health priority. I might now just throw back to Jane to see if there's anything else you would want to say about this example of acting commuting before we head to our Q&A session.
No, that's great, Bridie. Thank you.
Okay, so we are now at the stage where we can throw back to Cody to take us through our Q&A session. Thank you so much.
Thanks, Bridie, and thanks, Jane. I found that really informative. And someone who's actually studied an associate degree of public health and was wanting to pursue health promotion as a major, it's been great to watch the two work together in two different areas, but also the fact that they are so intertwined and have just different little specialty or pockets of interest that I guess each individual person who's wanting to pursue these as a postgraduate study would want to like kind of reach out. Do they want to move down that health promotion route? Are they really passionate about public health and maybe epidemiology and the overlap between them all and how you all work together to have a common goal, which is really cool to see. So the first question I want to throw out, we have one of our attendees has reached out. What would you recommend for someone who's looking to move into systems advocacy, public health or health promotion? I think, Jane, this might be a really good question for you.
Yeah, that's a good question. I would probably say if that's the space you wanted to work in and specialize in, I would say health promotion, because public health degrees always sort of include some advocacy work, like systems thinking and systems understanding, so sort of foundational to both programs. But there's probably a deeper dive because advocacy is one of the key health promotion strategies. So you get a deeper dive in a health promotion degree than possibly a public health degree, which covers sort of a broader range of content or knowledge that's relevant to public health more broadly. But I would suggest that you have a look at what's being taught. And that's probably my best advice. Look at the courses or the units that are in the degree program that you're looking at and make sure that that's covered. For example, we have a whole course on health public policy and advocacy and systems advocacy. But yeah, that would be my suggestion.
Thanks, Jane. And on that topic, to be honest, I have a really a imperative question that I've been wanting to get answers. What practical experiences or case studies are incorporated into the degree to prepare students for real world challenges, which I think really aligns to, I guess, what the student was looking to ask.
I think probably there's sort of three levels of answering that. I think we've all got really quite strong links with industry. And so we draw on our industry colleagues to, inform case examples and what's current and so those really real life experiences and examples. And in fact, a lot of our graduates are in practice roles. So we've maintained those connections and, you turn up to meetings and there are lots of graduates there and they share what they're doing and they're very happy to do that. So I think through that, I think too, a lot of our research is that the team undertake is with local community on different topics. So, for example, I've done some work more recently with a local domestic violence service around looking at mums and so that way, so we can bring the work that we're doing into our teaching. And the other thing we do is make sure that all of our assessments are what we call authentic, but basically our assessments replicate the tasks that you would be required to do when you get a job. So you do a health issue analysis like Bridie just talked about, and you carry that topic through and develop a plan develop the evaluation, and a lot of our graduates who are actually working and often working in aligned roles, or they might already be working in health promotion type roles, can work on topics that they're working on in their workplace as well. So that happens quite a lot with our students also.
So, Bridie, with obviously so many of, I guess, students balancing working most likely in industry and they're looking to pursue postgraduate study to further upskill and become further leaders in this field, how do they balance study? What does it look like in terms of being maybe a full-time like staff or like a full-time vocation or occupation while balancing postgrad to really level up their skills and become a leader in this field?
It's a great question, Cody. I think that the nature of our degrees are asynchronous, and so we know that our students are balancing competing demands, and so it it's great that our team work really closely together. So you'll have we're all sitting in offices next to each other, and so we have a really united academic team. But flexibility is very high in our understanding of what postgraduate students require who are studying online. And just because it's online and it is fully online and designed to that you can work through it at any time of the night or day, we're here and we're available. And it isn't online asynchronous, meaning there isn't connection to between students and teachers. So that's why that flexibility combined with us being here the whole way is something that I think I've found to be really valuable with students. And we get to know the different things that they're juggling, and we work really closely with our students to make sure that we can accommodate where we can, because this is a postgraduate degree and everyone has different demands going on.
I think that really segues to my next question, to be honest, is, how do I get in that journey? Once I'm in that study journey and I'm going to get to the finish line, where do some of these programs send some students? Like what do the occupations look like post-study? Bridie or Jane, honestly. Where do some of our alumni go on to? Is it what sort of work sort of environments are they end up working in, or is it in their current employment? A
Yeah,
lot of times with the students you've worked with.
Yeah.
bit of both. I think, yeah. So the state health departments have employee health promotion roles, designated roles. So a lot of graduates go into the state health system. A lot of graduates go into local government, and quite often local government employ community engagement officers and community development workers. So that's a pathway. I think I said before, the local primary health networks also employ our graduates, and they do a lot of community assessment work, and so our students are really equipped for that type of work. So there's also the Cancer Council, the Heart Foundation, all those big sort of NGOs that also employ health promotion specific positions are named as such. In Queensland, we've got Health and Wellbeing Queensland. In Victoria, there's Vic Health, which is under a little bit of scrutiny at the moment. But Vic Health in South Australia, they've got a similar foundation, as do Western Australia. So a bit of a range. Yeah.
And I might just also add, we did mention it a little bit throughout tonight, but we've also had a lot of students go on to do PhDs and then pursue a research career in health promotion. So having those capstone research courses embedded within the Master of Health Promotion. We've had some of our own students stay on with us and become PhD candidates and then contribute to the body of knowledge in health promotion through research.
My experience working here at UniSC, how many students I've met who's like, I'm going to study this because I want to further my career and earn more money in my position, but end up staying in PhD and research and end up teaching here and never leaving. And Bridie, I don't know if that is what happened to you as well, but I see it time and time again from students who literally started here straight from high school to mature age students who wanted to change a career. And obviously, it speaks to the culture setting and the one-on-one teaching relationships they have with their academics to have the confidence to be like, actually, I want to keep on working in this space and with these people and growing further impact and interest in these fields, which is really cool to see. We got another question that's just come through. If we start with the grad cert for health promotion, can we then transfer credit for the masters? Do we get
Mm.
placements counted towards it too? What does the online course look like? Do we have lots of case studies and courseworks to get done? Do we have Zoom classes? Self-study? How often? These are all really valid questions of like, what will my day-to-day look like?
Yeah.
Bridie, I think over to you. I think the first question, and we've covered this earlier in the presentation, is going from the grad cert, which is 6 months, to the masters.
Mm.
What does that look like in terms of credit?
Sure. And I'll try and answer that all in one. So yes, it counts towards, so the courses you do for the graduate certificate in health promotion are also in the Masters of Health Promotion. So you essentially then have credit. We call it articulating up, but yes, they contribute to your Masters. So you've essentially done a whole semester of work towards your master's by completing the graduate certificate. And then what does a week look like? We have online modules for all our courses. So those modules do not require any attendance at online workshops or anything scheduled in your calendar. It's that you work through those modules self-paced, but every course, each week, there is a Zoom session that is for drop-in to meet your course coordinator, discuss your questions in person. That's the connection that I'm talking about, where we have that face-to-face opportunity. You also meet other peers and who are studying at the same time, but it's an optional attendance, meaning that there's no requirement to schedule anything. It can be all completely done in your own time online, but there is the option to come to a weekly drop-in session. Did I miss any part of that question though, Cody?
No, that was
No.
fantastic.
Okay.
I think we're going to have to move to our last question for the night. If you do have any more dying questions, feel free to throw them into the Q&A. We'll answer them nice and quickly. But I think this last one, although it might be like a personalized experience, it might be a really good question for Jane. Hi, I've completed a master's in positive psychology and wellbeing science, and I've become interested in positive aging. I am unsure if this aligns. I'm currently a wellbeing student. How does this align to
Oh,
health promotion or public health? Jane?
yeah. I'm probably going to make an assumption and say that you're probably in your role as a wellbeing consultant interested in working with maybe or been working with at the individual level with people. So health promotion can happen at the individual level, and actually all the other health allied health areas have health promotion competencies or standards as part of their accreditation requirements also. So even when you're working with individuals in sort of those more allied health roles, I think it really encourage having some broader health promotion understanding helps you to understand, I think, some of the complexities for people in terms of what's going on beyond in their environments in particular. But I think, active aging and healthy aging is a national priority, and there's a lot more investment in thinking about what the needs are moving forward for our aging community. I don't know where you are, but I know it's a big priority for the Sunshine Coast. So I think there are a lot of policies and health promotion programs for that community or that population group, locally and nationally. And so my answer would be, yeah, I think you can draw on those knowledge and skills and apply it very, very locally, or think about, it might provide some opportunity to broaden out if you wanted to start to work with whole communities, for example.
Thanks, Jane. And for the individual who was asking that question, if you are wanting to dive deeper with Bridie or Jane, an email will go out tomorrow with a copy of this presentation, as well as booking times to have a catch up with Bridie and be able to talk about the program, but your personal wants and interests out of the program. What is your goal? Where do you see your career going? Where does the case studies and the passion interests align? To make sure that's the right fit, and opportunities to study at a full-time, part-time, or even starting at a later date, or studying with us in March, which is really cool to see. That's everything from us tonight. We just want to say thank you for joining us. Thank you so much, Bridie and Jane, for presenting our masterclass this evening and joining in on the Q&A panel. We look forward, for those who are looking at studying with us this year, look forward to seeing you on campus or online. And for the rest of you, if you do have any more dying questions, please reach out to our Student Central team or Bridie directly, where the contact details will be provided tomorrow morning. If you are wanting to have a phone call with our Student Central team about the program or how to contact us at UniSC, it's 0754302890 or information@usc.edu.au. Thank you so much for joining us this evening. Have a safe and warm night with your family, and we look forward to seeing you very soon. Thank you very much.